Welcome. I'm Greg Morrow, Program Director of the Conference Board's Employee Healthcare Conference, and I'd like to welcome you to our next session, The Future of Family Benefits. Before we begin, I'd like to cover a few housekeeping items. At the bottom of your screen are multiple application widgets. Questions can be submitted using the Q&A widget anytime during the session, and we'll address as many as we can at the end. A copy of today's slide deck and additional materials are available in the resource list widget that looks like a blue folder at the bottom of your screen. You can expand the deck by clicking on the maximize icon on the top right of the slide area or by dragging the bottom right corner. If you have any technical difficulty, please click on the help widget as a question mark icon and covers common technical issues. An on-demand version of this session will be available shortly after we conclude and can be accessed on the home page by clicking the home widget below. Now I'd like to welcome our speakers. Rena Scoblianco is a leader in human resources, serving as the Vice President of People at GoodRx, where she's in charge of overseeing performance management, legal compliance, recruitment, and career development. Prior to GoodRx, she brought her expertise to Ring, Contently, Comixology, and ThoughtWorks in the fields of human resources, people operation, and resource management. She holds a professional in HR designation from the HR Certification Institute. Gina Bartowski is founder and CEO of Kindbody, a seasoned entrepreneur and veteran problem solver. She launched Kindbody in August of 2018 with a team of seasoned healthcare and industry veterans.
We believe that going to the doctor,
both the provider itself and a high-quality network of fertility and family-building clinics. In addition to its brick-and-mortar clinics in New York, San Francisco, and Los Angeles, a network of more than 150 high-quality partner clinics, as well as global coverage in Europe, Asia-Pacific, and Latin America. Kindbody supports customers with true end-to-end solution from preconception through postpartum, offering 24/7 care, navigation, gynecology, mental health, nutrition, and return to work offerings. Rena, welcome.
Thank you so much for having me here, and thank you to Gina and the team for letting us participate in this session. At GoodRx, we're a mission-driven company, and we help consumers find the lowest cost prescriptions and healthcare, and help them with the affordability and accessibility around those issues. So Gina and I were laughing a couple of minutes ago. We're 370 employees, but we've been fortunate to have a lot of great growth over the past couple months. So that number is, outdated every time I turn on my computer. And for the most part, our demographic is on the younger side, currently skewing 90% of our employees under age 45, and then a 40% female, 60% male split. And when I was coming back from maternity leave, one of the first questions that my manager, our CEO, came to me was, how can we invest in our employees' well-being, particularly with regards to family planning and management? We realize that our demographic comes in different, shapes and sizes. People might be, looking to have a family sooner rather than later. Some might not be in a position to start a family, but would like the option to do so at a future date. And we have some same-sex couples as well. And we wanted to make sure that we're providing them different options too for, building out their family when the time is right, whether it be through adoption or some of the services offered by Kindbody. We looked at a variety of solutions, different partners, even looking into adding on riders to our insurance plans to provide more of a fertility benefit, which is not commonly included. And ultimately, after extensive research, we found that, Kindbody was going to be the best partner for GoodRx. And there were many factors that went into that. I think a key thing for us is the accessibility. The Kindbody facility is actually, I can see it from out the window within walking distance to both our Santa Monica headquarters, as well as our office in San Francisco. We also have a handful of employees who work remotely, even pre-COVID, as well as a small office distributed around the country. So if Kindbody didn't have a Kindbody facility nearby, they were at least able to help us partner and find partner clinics and physicians to support our team. So, being able to provide this really needed resource to our employees at an affordable price with the great accessibility and the wonderful team at Kindbody to, hold our hand and educate and provide, meaningless resources. It was kind of a no-brainer for us to, not only improve the healthcare experience to our customers, but also internally with our own employee base. So I will turn to you, Gina.
Thanks, Rena. I think Luke is going to play a Kindbody video. Luke, please.
We believe that going to the doctor should feel like a visit with a trusted friend, where you can get all the care you need in one place, where your health care is within reach at all times, in person or online, where the quality is high but the costs are low. We believe that your job should offer family-building benefits for everyone. Introducing Kindbody, a new generation of women's health and fertility care with a redesigned patient experience that's accessible and intuitive, with everything you need under one roof, from preconception through postpartum care. At Kindbody, we're on a mission to make these services more convenient, comfortable, and affordable for all. With clinics around the country, virtual and mobile services, we are dedicated to delivering compassionate care wherever and whenever you need us. Our goal is to make sure everyone gets the best possible care at the lowest possible costs. We are the doctors. We are the clinics. We are your end-to-end family-building solution.
Thank you, the conference board, for hosting us today. Rena, thanks for your commitment to reinventing fertility and family-building benefits. Just an introduction about Kindbody and what we're working towards. You saw the introductory video. The company was created in August 2018 and really grew out of a lot of feedback from employers. Employers want the ability to buy services direct. They want a holistic solution. Instead of just carving out this small piece of infertility, they want care navigation to help the member really think about their family building choices. As Rena mentioned, whether it's same-sex couples or single women by choice or women who want to proactively freeze their eggs, but really it's important to us and it's important to our clients to serve that member from pre to postpartum care. Maybe I'll set the stage and talk about the macro environment in family building. Family building and the fertility landscape has changed quite a bit in the last 5 years. Historically, many companies did not provide a fertility benefit. The reason has been the same reason that employers cannot provide a fertility benefit is the same reason consumers don't move forward with treatment, and it's cost. Historically, again, fertility treatment is cost prohibitive, and at Kindbody, we wanted to change that. We wanted to increase transparency and increase accessibility. 6 times as many people and consumers need treatment who can afford it. And so when we think about increasing accessibility, we really do invest in technology. And we'll talk a little bit about that, about member experience and how our technology really allows us to drive towards more affordable care. But today, again, more and more employers are asking for and offering a family building benefit. The family building benefit request is coming from the member population. I think 5 years ago, when some of the platforms were just getting started, people didn't know a lot about fertility or what a family building benefit looked like. Some of the media had said, well, is the request for a family building benefit coming from the top down? Is management asking women to stay at their desk longer? And that's absolutely not true. What you see and what you hear when you talk to members is the members are requesting, and in many cases, they're insisting on a more robust family building benefit. So 73% of employees say health and wellness programs are top consideration for choosing a job. We know that 82% of employees say a lack of progressive benefits would influence their decision to leave. And we know this has been documented in a number of member surveys, but 90% of employees with fertility issues are willing to switch jobs for fertility coverage. And again, it's when that patient has to pay out of pocket versus when the employer is going to sponsor some of the coverage, then it really does affect where the member decides to take their next position, or it also works in a retention effort. So a lot has changed in the last 5 years, and there is increasing interest from all employers. 5 years ago, the real interest in the fertility benefit was led by some early adopters, primarily technology companies in the Valley. But today you see interest from GoodRx. We have 2 customers even south of Santa Monica in Orange County. One is a bank, one is a telecom company. And so, again, interest is across the board in terms of size of employee and industry of employer.
And interject here, Gina. One of the things that was difficult, or I remember when the big companies were announcing this years ago, and I was thinking to myself, why offer this benefit? It sounds like you're forcing women to work longer, that you're not supporting family planning, and it kind of turned me off a little bit. Yeah. As I've matured and had my own experiences, professionally as well as a new mother, I was able to realize, okay, there's so much more to how I was originally perceiving this benefit and the goodwill that goes behind it. Additionally, when we were looking at providers, a lot of the offerings are for, large companies, thousands of employees plus. So to find one that was appropriate for, we're 370 now, we were probably 250 when we first started engaging, but to find a provider that was, specific and relevant to our employee size was, also really beneficial and led to this decision.
Yeah, thanks, Rena. It also, not only do we offer flexibility in terms of company size, but really flexibility in terms of company sponsorship. Not everyone, even the large publicly held companies with thousands and thousands of employees today have a hard time digesting 100% coverage of a fertility benefit because the demand has really driven up prices. And so it's cost prohibitive, not only for GoodRx, but for even larger, significantly larger companies. And so you really do have to prioritize a solution that fits within your budget. And so we allow all of our employers to decide if they're going to sponsor, whether it's a $5,000 sponsorship commitment or whether it's 1 cycle or 2 cycles, and they're going to ask the member to do a 10% copay or a 20% copay. Who drives the decision of what the plan coverage looks like is the client every single time. Our job is to listen and problem solve around your needs. And you may want to talk about some of the gaps in coverage that you saw at GoodRx and the culture at GoodRx and how we talked a lot about it, about how the culture of GoodRx and Kindbody just meshed, and that went a lot into the decision making when you were evaluating vendors as well.
Mm-hmm. Yeah, I think we both talked about accessibility and affordability being driving issues for both of our businesses. So sharing that common mission was, a no-brainer for us. I did talk to other platform providers in doing my research, but one of the things I was really hoping for was what can we do with our existing benefit plans to add additional coverage? Maybe it doesn't make sense to go externally, but through my research, I found that adding any sort of fertility rider or any sort of fertility benefit was pretty cost prohibitive on the benefit and employee renewal side. And that's why we opted to, bring on the supplemental program through Kindbody. We also, heard from employees and were able to structure an agreement that, gives our team access to lowered rates through the Kindbody relationship, as well as sponsor an amount that we feel comfortable as a company. And we've seen several employees take advantage of Kindbody to date. I don't get to see the full details because it's confidential. I just see when I get, the invoice to approve. but it's already been widely adopted by people who've been, struggling with some fertility. A couple women who've gone through the egg freezing just to have that option at a future date, and even some mental health resources. So I emailed Gina earlier this week. Unfortunately, we had a employee with a pregnancy complication, and within 12 hours had a full list of dedicated resources, from both Kindbody as well as partners in the area, to be a support network for this individual, as well as for myself in navigating that relationship with the employee. So as time goes on, I'm seeing even more and more the benefit, and I'm sure there'll be even more utilization as we hire more employees and as time passes, and their family planning resources might be limited or changing as well. I'm sure more people will come around to the perception of acceptance now versus what I had when I first heard about these benefits, and I was skeptical years ago.
Yeah. Thanks, Rena. I think, too, you bring up a good point, too. We should highlight that GoodRx today, under 1,000 employees, is a fully insured employer. And so we at Kindbody want to deliver solutions that work for, I mentioned, employers of all sizes, but that's fully insured as well as self-insured. And as Rena mentioned, that's right. Most employers today do want to offer a family building benefit. They hear so much from their member population. And the question is, how do I make it fit into my budget? And so if you do, and Rena alluded to it, but if you offer some sort of rider or solution within your commercially fully insured member population, what happens are those premiums go up on an annual basis inexplicably, right? And the carrier or the insurance company cannot identify for you why your costs have just gone up 20% plus. What's happened historically in healthcare, of course, is that premiums have continued to go up. But in many cases, the member experience and the patient experience has gone down. And so that's why you see such a movement. And I anticipate GoodRx will do the same. When you get to about 1,000 employees, what's happening, of course, are companies are moving from fully insured to self-insured so that they can really control cost, because otherwise you have thousands of employees, you're on a carrier's plan, and prices are continuing to increase. The insurance company, the middleman, unfortunately, those incentives are not aligned because the carrier's job is to increase margin and is going to refer to higher priced or more expensive doctors regardless of quality. And it's just hard. They're not bad folks. They're just hard. When you sit in the middle, it means you would have to integrate with the scheduling and the practice management tool to be able to have the visibility that the employer is asking for today, which is, how many embryos were transferred? What's your single embryo transfer rate? What are your success rates? What are your success rates by age? And so early on, again, based on some employer feedback, we knew we had to be in the technology business. And so all of our members have a patient portal. What our patient portal does is allow for not only complete transparency to the employer. Now, as Rena alluded, all the patient information is redacted. So it's available to her and completely transparent, but all of the member IDs are redacted. But what we really want to do with this focus on member experience is to help the member understand their journey along the way. And if you know your success likelihood at the very beginning, there is less disappointment later on. If you're told up front, hey, you're a poor prognosis case, it could take 2 chances, it could take 3 cycles, it could take 4 cycles, then the patient feels better. They trust their partner. And we believe at Kindbody that you really do have to be in the doctor business. You have to be in the provision of care to effectuate change in that member experience. We also believe only 3 things matter in healthcare: patient experience, outcomes, and cost. And again, you have to be in the doctor business to effectuate change in any one of those 3 areas. But again, as GoodRx and Rena mentioned, a real focus on retention, attraction of employees, and a net promoter score. Ours is 92 today. I've told the team, in my opinion, it's unsustainable. It's a fantastic NPS. We treat thousands of patients. Every time I say every month it's measured, it's unsustainable at 92. Then our Los Angeles team there is led by Dr. Meredith Brower. she has 100 NPS, and that's definitely unsustainable. But our clinical team is really focused on NPS and member experience. And then, Rena, you may want to talk about the employee population. You mentioned in Santa Monica, we're very close to you guys, but San Francisco, and you have remote employees as well?
Yeah, so we have satellite offices, so San Francisco, New York, St. Louis, and South Carolina, so Charleston, and then probably about 20 other individuals working in different locations across the country. And so one of the drivers when we originally spoke was not only to have these beautiful facilities accessible to where a core part of our team is already based, but also the ability to connect with and contact and identify partners. If we have one employee working in Arkansas who wants to be interested in this benefit, how can Kindbody help us identify and provide, the same level of resources and care to those individuals? So being able to offer this to everybody at the same level, despite where they're located, was really meaningful.
Yeah, thanks, Rena. And it starts with that patient engagement on that patient portal. So whether the patient is coming to a Kindbody location or to our partner clinic in Charleston, South Carolina, they all have a Kindbody care navigation person to help them to follow that member through from pre to postpartum, so that if the member suffers a miscarriage, that the member is not shuttled around to a mental health specialist and then shuttled back to their OBGYN for the DNC, that there really is this holistic care. And again, as an example, when you guys see this on the screen, that's an exam room of a Kindbody exam room. All of our Kindbody locations look very similar, but you can see we've reinvented family building care. And the video you saw speaks to that as well. Some of those folks in the videos are they're members and patients of ours, but many of the folks in that video were physicians. Our physicians don't wear white coats. We want the patient to feel like they have a true partner on their journey to trying to conceive. And it's little things like making the exam room comfortable, not leaving the patient waiting, not being in a white coat with white walls and your medical degrees behind you so that there's this paternalistic nature between the doctor and the physician. We've really removed those traditional ways of healthcare and reinvented care and member experience.
When we first toured your Santa Monica facility, I felt like I was walking into a spa. I mean, It was so relaxing, it was so warm and inviting. It was, not your standard OBGYN office. And when, we first came as well, I brought one of my colleagues with me who was having some conception concerns, and was able to sit down, I think it was with Dr. Brower, and actually, in real time, sit and address what were the concerns, what was the treatment she had been undergoing with specialists, and, how could Kindbody support? Or if her situation was slightly unique and required, a higher level of treatment, helping, identify and have that conversation up front. And I think that transparency, further instilled trust in us, knowing that you're doing what's for the customer's, highest results, best outcome. And that even if that means looking, outside of Kindbody, but that resonated really deeply with myself and that individual.
Yeah, thank you. You mentioned Dr. Brower. We know when we do member surveys, again, that more than 80% of members prefer a female clinician. All of our REIs, which is reproductive endocrinology and infertility specialists, are women. We make data-driven decisions. And so when the member expresses an interest more than 80% of the time for a female clinician, they see a female clinician. We have men. We love men. Our HCLD is Dr. Tim Smith. Our senior embryologist is Raj Joshi. They're in the lab side of things. Again, the focus on member experience and having a doctor that looks like me and feels like me, and diversity and inclusion has been at the heart of our value system since the very beginning of Kindbody. And so when we think about our clinical team of women, we also think about ethnicity diversity even within our clinical team. So we have to be able to be multilingual. We again are fundamentally on a mission to increase access to care. For too long, fertility was for the kind of this white, wealthy 1%, and fundamentally and morally, there's just something wrong with that. And so the employers have now embrace that as well. And they're conscious. You make conscious decisions. Again, GoodRx has plenty of funding, right? You guys were just, I think, a $3 billion valuation. But you want to be prudent. Your responsibility, even if you have millions and millions of dollars in the bank, is about prudent and good stewards of the dollars that you do have. And so you may want to talk through some of the GoodRx and the solutions you saw through Kindbody.
So like which specific offerings we chose?
Yeah, sure. You can speak to that, Rena. That'd be great.
Yeah. So for us, we found that, giving employees, I think we contributed to, we get the 20% discounted rates, which I think for egg freezing, which is one of the key items we've seen, runs about $5,000. Medication is additional on top of that. So we were covering, we give employees $1,000, lifetime to contribute towards that. So I think without Kindbody, egg freezing can be upwards of $15,000. For our employees going through Kindbody, they're only paying $4,000 out of pocket. And with, rates increasing constantly, that has enabled many of our female employees here to, freeze their eggs and be proactive and, having this option at a future date.
Yeah, thanks, Rena. I mean, it is a very popular request right now. So we provide full service, I mentioned, from pre to postpartum care. And certainly the core services we offer today are traditional infertility services, IVF, IUI. We see a high percentage of same-sex couples, trans couples, and then single moms by choice and elective egg freezing. And egg freezing, that because of the interest, again, it's supply and demand economics, the price for egg freezing has gotten cost prohibitive in most major metropolitan markets. It's $9,000 to $10,000. That's for the consumer. The employer then foots that bill. And in many cases, women, whether they're going through IVF or egg freezing, they need more than one cycle. So you're talking about an expense that's $30,000, $40,000. And Rena mentioned it's $15,000, so it's about $10,000 for the treatment, but another $5,000 for the medications. And the members, again, when you poll members, there's such an appreciation for their employer to be able to provide a benefit. And so it's game changing. But at Kindbody, again, we allow for direct purchasing. So whether you're coming to a Kindbody clinic or one of our partner clinics, we provide you a standardized case rate across the country. We want to make this easy for Rena and the team at GoodRx and our other customers to be easy to roll out. And what makes it hard to administer often is, wait a minute, I have 15 different vendors. This one does infertility. This one does return to work. This one does pregnancy. So we're one solution. We provide end to end. But the other thing on our rates, we keep the rate consistent. Think about this. We keep the rate consistent whether you're seeing our doctor in Santa Monica, Charleston, New York, Chicago, or San Francisco. And what that means is just really easy for the employer to administer, whether they want to run it through the carrier and the TPA or whether they want to do a full carve out. It's got to be inclusive and easy for the employer. Today, what's helped accelerate the interest in Kindbody is we are for sure the most cost-effective solution in the marketplace. And we're in a recession. We don't know how long or how protracted the recession will be. But again, even large companies today are thinking about ways to conserve cash and just buy smarter. So, and then I think, what we know at Kindbody is that premium care experience, the reinvention of care. The session today is on the future of fertility. You don't have to sacrifice, and we would argue you shouldn't sacrifice a very premium experience with your fertility doctor just because you're getting more value for your dollar. So at Kindbody, we can offer you a premium experience, but it's at a much more affordable rate. And in most cases, again, it's 30% less across the industry. Here's a picture of Dr. Brower. Go ahead, Rena. You're going to jump in?
I was just going to say, and your team made it so easy for us to roll it out to the company from pre-populated emails, personalized flyers, which if you walk into reception are sitting right there, as well as outside of my HR office. And then Dr. Bauer came and gave a lunch and learn to 40 of our employees back when we were in the office as well. So from an HR perspective, an individual who's managing a lot on the plate, it was kind of a no-brainer to add this great benefit. But the time to roll it out was nominal because Kindbody, had done so much of the legwork, communications, and personalized it to us as well. And when I'm talking to candidates and saying, here's one of the perks that we offer, not only is it great because it differentiates us, but it also shows the company's commitment and understanding to supporting families and diverse backgrounds. And when you're in, fast-growing tech startups, it can be long hours, it can be long days, and, prioritizing family can sometimes be counterintuitive to that. But by demonstrating this benefit to our, new hires, it shows, you can do both in a great company setting.
Yeah. Thank you, Rena. You mentioned inclusivity is really important to both GoodRx and Kindbody. And then again, this real focus on member experience and transparency and care navigation, all things that are key to us. Dr. Meredith Brower is showcased on the left, and then that's Dr. Lynn Westfall. Dr. Westfall is our Chief Medical Officer. Prior to joining Kindbody full-time in January 2019, she spent the prior 23 years leading Stanford's fertility program. So again, high-quality physicians as teammates, a real emphasis on outcome and quality care, but you don't have to pay a premium price tag to really receive a premium experience. You also mentioned the other thing as we reinvent healthcare and talk about the future of family building, it is about bringing care to the patient. Instead of the patient having these long wait times, instead of the member having to wait to see a doctor or sitting in the waiting room, even though they have an appointment at 10 a.m., it's 10:45. And so we bring care to the patient. We have retail locations, so that's very accessible. But Rena mentioned we also do lunch and learns on site. Our clinicians are happy to go to speak to employers. And the other super cool thing, when we launched, we were still building our clinics in the respective markets. So we launched with mobile clinics, and they were significantly more popular than we ever anticipated them being. And so for those of you that don't know, a fertility cycle is typically about 2 weeks. And all of those fertility visits, which include blood work and an ultrasound, can be done in a typical exam room. So our fertility bus has 2 full-service exam rooms. The only part of the fertility treatment that you cannot do on our mobile clinic is the actual egg retrieval, and that's done in our lab. So that's done on site. So you could see, even if you were 15, 20 miles away from one of our locations, we can bring care to you. And again, it's member happiness and these lunch and learns and bringing care to them. And then that one day, the actual egg retrieval is about a 10 to 15 minute outpatient procedure. And the members love it because the solution is built around their needs instead of the physician needs. And so that's really what's allowed for a lot of our early success as well. We mentioned earlier that cost matters more than ever, particularly in a recession. Quality care, to me, has to be a given. And we see that. I mean, one of the biggest things that's changed in the fertility industry over the last 5 years is there are 2 relatively new technologies that weren't widely adopted 5+ years ago that are standard of care today. Those 2 technologies are vitrification, which is the flash freeze process, and genetic screening. 50% of all embryos are genetically abnormal, so genetic testing really allows the doctor to choose which embryo is normal versus abnormal and then freeze the rest. Now that those technologies are standard of care and in our value-based case rate, everybody has equal access to the exact same technology, and what you see now is a parity of success rates. So when everybody, again, whether they're in Charleston or Chicago or Santa Monica, all of the doctors from an outcome standpoint are very, very close. They're 1 or 2 percentage points different. But again, in a industry where there's becoming standardization, in particular as it relates to success rates, prices should start to moderate and come down, and that's not happening in the fertility industry. So Kindbody's on a mission to, again, bring accessibility to more patients. This is our clinic map. At the beginning of the discussion and session, I think Greg mentioned we had 150 clinics in our network. This deck was provided to the conference board about a week ago. We already have 200 locations in our network today, so lots of growth in our network partnership. We're able to guarantee to GoodRx and to our other clients no gaps in coverage. So we have the United States pretty well covered. What we hear today is more and more of a request for global coverage. And I'm sure as fast as GoodRx is growing, they're going to be asking for similar coverage. But we do provide global care and global navigation. In the United States, I mentioned there's standardization of care. There's widespread adoption of vitrification and genetic screening. That's not true internationally. And so you really do need a global partner who understands the differences by country. So, and it's hard because you're trying to satisfy for your member population, but in many countries, genetic screening is illegal. IVF and egg freezing and sperm freezing are illegal unless the couple is married. Certainly, same-sex couples are not allowed to marry in some countries, and so they can't take advantage of the benefits. So really having an understanding and a network of high-quality physicians globally is critical when we talk to our employer customers as well. So again, this care navigation, multilingual. We were on the phone with a client. We got our poor Asian colleague who has spent the last 6 years in Shanghai. She's in Singapore now. But being able to speak Mandarin, you have to be able to speak the native language, again, to be able to improve the member experience from a global standpoint. Rena, this is what you talked about, but these are one of our Fertility 101 events. This happens to be in San Francisco. But really, today's patient population is curious. And that's different. They used to be subordinate, and the doctor would preach to them what the protocol was going to be, and they used to guide the discussion. Today's members come in, and they know. They know in many cases they either need IVF or they're going to need donor sperm or they're going to need donor eggs, and they're driving a lot of that communication, and we welcome that. We're here to be a support system, a peer of theirs on their journey, and really to empower and engage the member population. So again, our mobile clinic, we hosted with another employer client in the Santa Monica area. This mobile bus has taken on a life of its own. I think it has its own Instagram page now, but Rebecca Silver leads our marketing department. Again, the mobile bus is wildly popular. And then, I think our commitment to diversity and inclusion has been core to Kindbody's values since the very beginning. I know it's core, again, to GoodRx since the very beginning. Doug Hirsch, the CEO of GoodRx, has been a big proponent of ours. He loves the fact that we're a women-founded business. Female entrepreneurs are not capitalized like other male entrepreneurs are. In order for us to really be able to showcase our opportunity and get growth, we need people like Doug and other male CEOs who make a concerted effort with intent to select vendors that have a women founding team, a women executive team. Again, it's been core to ours since the very beginning. We also feel strongly, I mentioned it earlier, but it's worth reiterating, not only do we think first and foremost about diversity as it relates to gender, but even within our women clinical community, we have African-American doctors, we have Indian doctors, we have just a wide variety in terms of ethnicity of our physicians. We also view ourselves as a leader in the fertility industry. We do have a pretty wide following on our D2C business. And so it was important to us to do 3 steps in the aftermath of the George Floyd killing. The first thing that we did was donate to Black Voters Matter into Colors of Change. Kindbody set up a $50,000 grant for women of color who are disadvantaged and need fertility treatment. And then the third thing we did was give Election Day off as an additional PTO, because it's important to vote in this country. And again, Rena's smiling because I sound like I'm reading from GoodRx's, employee manual, because again, that's when you find clients. This was relatively easy, Rena. I know you vetted other vendors, but it just seemed like there was just so much like-mindedness in what we wanted to accomplish, and really our intent to be fast-growing venture-backed businesses, but to always have a focus on member experience and really a fundamental responsibility to lift others up and to provide more accessible treatment. Right, Rena?
Absolutely. And, I think one of the things I've been hearing, from employees and, in light of, recent events is how it can be challenging for, some Black employees or, our colleagues of color to conceive or have a successful pregnancy. And, there's there's real disparate data there showing that it can be more challenging. So I think there's even more of an opportunity in light of, these inclusive efforts of, why is that, and how can we make sure to, increase the successful birth rates in those underserved populations.
Yeah, that's right. Black women suffer 2 to 1 PCOS and have a harder time of conception. So they suffer infertility twice as often as Caucasian women. And in fact, at 3 o'clock today, we have a webinar on race and fertility. And then after kind of conception, African American women have a harder time carrying to term than Caucasian women. And you really have, it's incumbent upon all of us as Americans, but, I'm just really honored to be a partner to GoodRx, because fundamentally they believe the same thing, that if we don't speak out and help the underrepresented, that's really what's going to lift all boats in the future, is a commitment from top leadership to create more accessibility for less fortunate. So we're happy and proud to partner with GoodRx. I think that probably wraps up our discussion, and we can open the floor, Greg, to questions.
Sounds good, Gina. First question, what member preferences are you seeing today versus 5 years ago or versus 10 years ago?
Yeah, I mean, the biggest member preference, several. The egg freezing audience is huge right now. I think what happened is, prior to 5 or 6 years ago, the efficacy of egg freezing was not there. And that's because they were using the old technology of how you freeze eggs. It's called slow freezing. But today with vitrification, if you freeze 12 eggs and you go to thaw them to proceed with IVF, you get almost all 12 back. You deliver 12 back. So the efficacy of egg freezing has really propelled the growth. You see it, most all employers, we used to offer it as an option. Today, most employers just add it. It's part of fertility. The interest is there. It's hard to underestimate, too, the value that the members, the same-sex population, the LGBTQ and trans community really appreciates this member benefit. They were inadvertently prohibited and discriminated against until 5 years ago, because if you had a plan designed through the carriers, you had to be married and heterosexual for 12 months before you got to participate with the benefit. And so really, 5 years later, it's crazy that only 5 years ago did this country recognize same-sex couples as able to be married legally. But that changed a lot. More and more same-sex couples are having biological children. More and more women are also having, it's called single moms by choice. And now we're seeing dads. So now it's single parents by choice. So, I think what's happening, Greg, is the family makeup looks very different than it did 5 years ago. And, the employers are no longer afraid to support. They embrace building a family however you choose to build it.
Thanks, Gina. Question for Rena, and I think you did talk a little bit about this, but if you can expand on it. Someone's asking about your employees' reception to the fraternity benefit. What's it been like?
Oh, it's been overall quite positive. We do a lot already to, acknowledge employees and make them feel part of the GoodRx family, and, do that through a handful of ways. But, to even just acknowledge that fertility can be an issue for some, or not even something that many individuals, have or can consider for a variety of reasons. It was, there was nothing negative that ever came out about it. It was more, thank you for adding this. Thank you for, considering new ways to expand and improve the healthcare experience and bring that very personally in-house to our team. So, as I mentioned before, the Kindbody team has been great in having, one-on-one conversations with employees, letting them come see the, office at whatever frequency they would like, and then having that ongoing partner relationship with those individuals. So, I have yet to see more on the same sex, utilization of these benefits. I'm hopeful that that's something that, other colleagues will start taking advantage of when the time is right for them. But I think the perception of this at least gives me more options on timing, on affordability, on, support. We have, parents who, had a successful first pregnancy, but are now struggling to conceive a second time. Knowing that there's more support from the company, both, financially, emotionally, and just in prioritizing this as a benefit, has definitely been something that's commonly come up in employee reviews and feedback, and just, one of the most highly rated benefits that we offer our company. And we're very generous.
Yeah.
Thanks.
But that's what's happening today, Greg, is as more and more women wait to get married and wait to have children, in some cases, they don't have any problems getting pregnant with their first child in their mid-30s. But 50% of all IVF cases are what's called secondary fecundity, which is secondary infertility. You didn't have any problems with your first child, but you had that child when you were 35 or 36, and now you're 37, 38, and you do need fertility services to conceive. So again, we're just seeing it as these macroeconomic trends where more women staying in the workforce and waiting to have children. Again, fertility is a big need and a much appreciated member benefit for sure.
I mean, I can speak to that personally. That's, the phase that I'm about to enter into right now. And, knowing that I have Kindbody to support me, in a couple more cycles if I try, it just takes the stress off.
Yep.
Thanks. Thank you. This one's for Gina. What is Kindbody projecting in the way of clinic expansion into new markets? Will the clinic growth be substantial enough to support large nationwide organizations?
For sure. We can do that today. If it's just not going to be the Kindbody experience in Charleston or the Kindbody experience in Indianapolis. That would be one of our partner clinics. They are going to come in through our patient portal. They're going to have a care navigation team. So all of that warm, soft touch they will have. But in regards to our expansion, today we're in Los Angeles, San Francisco, and New York. We have 2 locations in each market. In the Bay Area, we're opening in Los Altos this fall. In New Jersey, we're opening in Princeton this fall. In Los Angeles, in addition to our Santa Monica location, we're opening in Century City. And then in New York, in addition to our Flatiron location, we have Bryant Park. So those are the locations in the markets we're in today. And then we are opening in 2021. Our locations have been identified in Atlanta, Seattle, and Austin. And those locations were really determined by a lot of the member feedback that we've received. And then we have certainly a growth map after Atlanta, Seattle, and Austin. We get lots of requests for Washington, D.C., so that's of interest. So we really build our solutions and we go where the employers need us to. So we're incredibly service-oriented when trying to problem solve with the employer.
Thanks, Gina. Question for you. How can you ensure savings?
It just goes back to kind of healthcare and where we are today versus where we came from. So in healthcare, most all employers used to be fully insured, and certainly prior to Obamacare, they used to be fully insured. Once Obamacare came in, the employer said, wait a minute, I need control of my cost. What I can't do is continue to have premiums going up double digits every year. And I'm responsible for paying these premiums, but service is going down. And so what happened is more employers moved from fully insured to self-insured. The minute they made that switch, what the employer was able to do was capture immediately a 15 to 18% savings. And that's because that's the money that they were, that carrier, that middleman was taking. They were taking the provider fees and increasing those 15 to 18%. Now, in many cases, what happened is they still keep the carrier. The carrier is just the TPA instead of buying or utilizing the network. So immediately when you buy direct through Kindbody versus using any of the other fertility provider platforms, you have that immediate 15 to 18% savings. The other savings come in, the way you're able to get to 30% plus savings is through our technology. So 1/3 of all fertility clinics today are still on paper charts. So there's just a lot more labor that's required when you're trying to manage a clinic and you're trying to manage a patient's record on paper. We also have the only online booking tool in the entire country. Today, there's a lot of inefficiency and a lot of people. You call a fertility clinic, you're on hold, they get to call you back, you're in a meeting, you and call them back. It's just tremendously inefficient. And so with this investment in technology, we're able, if you look at our Los Angeles clinic, when we opened LA, we opened only with a clinical team. Everything, all of that back-end office was run out of our corporate office in New York City. But you can imagine the savings that we push back to the employer when we don't need an operating partner, a marketing director, a billing person. All of that corporate infrastructure is coming from corporate instead of there in LA. And so those savings, that operational efficiency, which is provided through our technology, are passed on to the employer. So it's both simply removing the middleman and utilizing technology to bring down cost.
Okay, Gina, we have a follow-up question to that I want to get to. It'll have to be the last one. The question is related to how prohibitively expensive fertility drugs are. The question is, do your savings include medications?
We do, yes, of course. Now, the savings that you see as the employer running through Kindbody, it is a carve-out. It's separate from the PBM, but the savings are, again, north of 25%. In some cases, they're 30%. We have relationships directly with the manufacturers, but we do offer Kindbody RX as well as the treatment. But you know, the medications are a big part of the expense, and so savings there is pretty significant as well.
Thanks, Gina. And thanks, Rena. We really appreciate you being with us, sharing your time and your work. Attendees, we'd really appreciate your feedback. A survey will pop up where you can rate the session, or you can click the survey icon at the bottom of your screen. Kindbody's live exhibition space is now open. Please click the link, which will pop up, and will take you directly into their space where you can talk to their executives through the chat function, download information, and learn more about Kindbody. Take a look at what other sessions are running live today at our 3 p.m. Eastern time slot. Please click on the homepage icon at the bottom of your screen. And with that, our presentation is concluded. Thanks again to Kindbody. Thanks, Gina. Thanks, Rena. We appreciate it. And everyone else, we'll see you soon.
Thanks, Greg. Thanks, Rena.
Thank you very much. Have a great day.